Written documentation. Maintaining documentation means keeping a record of everything you do and what you observe during a visit with your patient. As a home health aide, you will see many patients, and it can be difficult to remember everything that each patient ate, did, or said. It is important that you never delay your documentation. Why is documentation so important? It is a clear and complete communication between members of the home healthcare team. It's also a legal record of a client's treatment, and medical records can be used in court as legal evidence. It protects you and your employer from liability by providing proof of what you did on every visit with your client. Poor documentation may result in denied funds. Funding for the agency is dependent on your documentation. The agency must pay upfront for the care and then is reimbursed later by insurance. Since documentation is basically describing the care received, the insurance company reviews the documentation to prove that care was given. Why is documentation important? Your documentation is a legal document. What is written in the chart is considered in court to be what actually happened. If something is not in the chart, then legally it never happened. Failing to document or documenting incorrectly can cause major legal issues for you and your agency. Documentation should always be thorough, timely, accurate, and pertinent. According to federal standards, a home health aide must possess communication skills that includes the ability to read, write, and verbal report clinical information to patients' representatives, caregivers, other home health aides, and family. There are certain standards that you must adhere to in your documentation. All documentation must include the date and time. It must include the client's name. It must be written in blue or black ballpoint pen in case copies have to be made. You must sign your full name at the end of your documentation. Use accurate terms and only use approved abbreviations, never slang. It should support the plan of care. Note both care given and when care is refused. Document any phone calls made or received. Document any changes in condition, and note any reports given and to whom. Write your notes immediately after the visit when everything is fresh in your mind so you can remember all the details. You may think you'll remember the details later on, but unless you jot it down, you likely won't. Think about what you want to say before writing. Write facts, not opinions, and write as neatly as you can if using paper documentation. Document as specified in the care plan. Some agencies have checkoff sheets for documenting care on an ADL sheet, or activities of daily living. If you make an error, it's not a big deal, but you do have to correct that error properly. Documentation can be done electronically or on paper. If you notice an error in your documentation, you should change it immediately. Changing your electronic documentation is fairly straightforward, and it should be shown to you during training and orientation to your agency. If you need to correct written documentation, it must be done in the following way. Cross out the error with a single line, not a double line and not a scribble. At the end of that line, initial and date it. Never erase and never use whiteout. Once you've crossed out the line, add in the correct information. There are some important pieces of information that your visit record must include: daily measurements, safety needs and concerns, client statements, client complaints, and unusual occurrences. The home health aide follows the plan of care. Any measurements that are required in the plan of care must be carefully and accurately documented, such as vital signs, any weight, blood sugars, intake and output, meaning the fluids taken in by the patient and the fluids coming out of the patient, bowel movements, how often they happen and what their consistency is, how often they urinate or void, and any strength or mobility issues. A home health aide is there to perform tasks as outlined in the care plan, but they also have a larger responsibility to care for the patient. Safety needs can include things that are needed for care, such as non-slip mats in the tub, handrails and grab bars, assistive devices such as canes or walkers. But safety needs can also be things in the environment, such as broken windows, fire hazards in the home. These concerns do not need to be shared by the client. If you have safety concerns, you must document it and report it for the well-being of your patient. Sometimes your client may say something that should be recorded word for word. Always put your client statements in quotations exactly as spoken when documenting them. For example, if your client states, "I've lost the will to live," it would not be appropriate to paraphrase or document "client feels suicidal." The exact words of your client many times carry more meaning. If your client makes statements such as the one above, document the statement in your narrative charting and be sure to report the concern verbally to a family member and discuss this with your supervisor. When documenting a client complaint, stick to the facts and try to eliminate your opinion about it. Complaints could be, "The right side of my head is hurting." "I think someone is going through my garbage bins at night." "I think you are going through my garbage bins at night." This is not the time and place to plead a defense or in comprehensive form in the documentation. It may seem like silly nonsense, but it may be clinically relevant or relevant in another kind of way. When documenting a client complaint, report it as a client statement. For example, if your client complains that she thinks you are going through her jewelry during the night, simply record the statement in the patient's words. "Mrs. Wolby stated, 'I heard you going through my jewelry last night.' I reported her statement and concern to my supervisor." Unusual occurrences are also something that should be documented. Is there a gas leak in the neighborhood? Is there an angry neighbor that's yelling at the doorstep about something? Is there a questionable nephew staying overnight and the client complaining that she can't find her favorite necklace? Is your dementia patient accusing you of taking her mother's silverware? There are lots of unusual occurrences that may cause concern or questions down the road. So it's better to have documented that there was a concern at the time than address it after the fact. If something happens, it must be documented in an incident report. Report the incident as soon as possible and before leaving the patient's home, and always speak to your supervisor before completing the report. An incident report is a written record of events that happen in the home and describes your role in it. It is there to protect you. For example, if a patient broke a vase, then forgets what happened, you might be blamed for this. You should file an incident report if your patient falls, you or your patient break or damage anything, if your patient or family member makes a request that is out of your scope of practice, if your patient or family member makes a sexual advance or remark, if anything happens that makes you feel uncomfortable, threatened, or unsafe, if you get injured on the job, if you're exposed to blood or bodily fluids. If you need to document an incident report, complete it, but don't mention that you completed it in the documentation, as this can be a red flag for reviewers. In the documentation, write down the incident accurately and that it was reported without mentioning any additional separate documentation that was completed. A final word about documentation. There's a saying in healthcare, if you didn't document it, you didn't do it. Documentation is one of the most important things you can do to care for your patient. Remember, be as accurate as possible. Your documentation is a legal document. Be detailed and complete. Your agency's funding depends on your accurate documentation. And be factual. Your patient's treatment and health depends on your careful observations.